The Andy Kim Christmas Show will be back this year live and in person at Massey Hall. Live music fans will gather this Wednesday night to celebrate the spirit and generosity of the musical community, with all proceeds in support of CAMH Gifts of Light.
And some of the special guests joining the show will be Billy Talent, the Sheepdogs, and Julie Black. Also part of the show is singer-songwriter Jake Clemons. Jake, thanks so much for making time to chat with us tonight.
My absolute pleasure. Thanks for having me.
This is your third time being part of this annual Christmas show. What brings you back?
Andy Kim's an amazing guy, and the Christmas show is always a spectacular event, and it goes to such a great cause. I can't help but be a part of it as long as I'm available. It's something I'm honored to be a part of.
You were the saxophonist for E Street Band. Can you remind our audience how that all came to be on stage with Bruce Springsteen?
It's been 10 years of playing in this role at this point. My uncle played previously until he passed away in 2011, and then I was ushered in as support for that role, and it's always been an amazing experience to be around that extended part of my family, and to be on stage with them is the best in the world.
I wonder if you can tell us a bit about what the pandemic's been like for you. I know you had a couple of performances just last month. What is it like to finally be back on stage now?
Oh my gosh, I was hurting. I'm not gonna lie. It was a long stretch of no shows. I was lucky to welcome a new baby into the world February of 2020. So. It was a really beautiful time, and I was actually able to stay home and change diapers and and be present, which is wonderful. Nonetheless, I love rock and roll, and the stage has been calling hard, and I'm really grateful to be playing shows again. Mm-hmm. It's something I love. I love doing it.
Yeah, congratulations on your baby. I remember a few months after having a baby, I was ready to get back to work as well. Get out of the house and get back to what you do. So what is that going to feel like to be back on stage?
Well, this show is going to be amazing because it's like Massey Hall is reopening. So I've never actually even been there before, but I've heard it's a legendary venue, and I've heard all the stories from Neil Young and et cetera, et cetera. So this show specifically is really exciting. We played a show in Toronto at the Horseshoe about 3 or 4 weeks ago, and that was a great time. So just getting out in front of people again is we need it. We need it bad. So I'm grateful for it.
This is also, we should mention, a charity event, and the profits, the donations from this are going to be going to CAMH. Can you tell us about what this means for you?
Andy Kim's always he's really geared towards giving, and that's one of the things I find really beautiful about who he is and about what he does. So giving back is super important, no matter what your relationship is with like what your financial status or whatever. We all have to give back in some way. So as a musician, to be able to give back this way is really big.
Well, you are in for an amazing experience, because Massey Hall, before the last 3 years of reconstruction, was incredible, and now a lot of people have been excited. Gordon Lightfoot was playing there for a few days to reopen it. So when you get those fans in there and you have this show underway, what kind of magic happens when you have that live audience in front of you that we've been missing for years?
Yeah, to me, it goes back to the beginning of mankind. It's people gathering together to share a moment, to share the same breath, to share some excitement. There's nothing that compares to it. There's no piece of ether that can come close to that. Just the chemistry and the excitement. I don't know. It's almost like everyone's connected in and dialed into the same battery or something, and it's the most powerful thing I've ever experienced. So, I'm expecting that to be full on tomorrow night. I know everyone on stage has been desperately anticipating a night like this. So it's going to come with great excitement.
Yeah, you're really talking about the power of music, and it's a really special thing to experience. I'm sure this is going to be special for people who are there watching you, but what will this mean to you?
It's just the thing I love to do the most, There's a lot of things I love. There's a lot of things I love to do, but making a connection with an audience in person, like feeling the energy and exchanging it back and forth. It's the biggest thrill that I've ever experienced, and it's something that I just love to the bottom with the bottom of my heart. It's going to be great.
Especially with that saxophone solo, right? Like, take us through one of those. What is that communication with the crowd like?
Well, it transcends saxophone. It's kind of like, I consider myself to be kind of a conduit. The energy comes from wherever and from the audience, and I don't know. I kind of feel like I get to direct some of that energy, which way it goes in some way. Yeah. So like when things are cranking, when the music's blaring and the audience is excited, yeah, I don't know. It goes to the roof. It's it's a joy.
Jake, are you at the studio tonight?
I'm actually at the studio.
Okay, well, good
I'm
luck.
Currently working out some new stuff.
Thank you so much for making time to chat with us once again this evening, and good luck on the performance this Wednesday.
Thank you so much. I really appreciate it.
Thank you. New modeling from the province shows COVID-19 cases and positivity rates are rising in most public health units.
The Ontario Science Table says the rise in cases is due to the Delta variant and projects the spread of the new Omicron strain will likely drive cases above current projections. For reaction to this, we're joined live this hour by Peel's Medical Officer of Health, Dr. Lauren Slow. Thanks so much for making time, Doctor. I want to start with asking you about this new data because it actually doesn't consider the new Omicron variant. Is that concerning to you?
Well, I think, honestly, I think the Science Table's statement was very clear. Omicron is certainly something of concern, but it is still in the very preliminary stages, and we're trying to understand from other countries and jurisdictions what we can tell about this variant in respect of transmissibility, severity, etc. But the Science Table's modeling is fairly clear that Delta remains our dominant foe at this point in time, and that certainly across Ontario, including in our own region of Peel, that there are increases that are starting to be observed, likely given by the fact that more people are spending time indoors, and also that our 5 to 11 population still remains largely unvaccinated.
And the modeling also pointed out that testing seems to be plateauing. Dr. Lowe, is there another region in this country that we could be looking to improve on that?
Well, I think testing plateauing is really just more speaking to the test positivity in the modeling and trying to understand whether the increase in cases they're seeing is due to just not testing enough or not necessarily being able to access tests. However, because they're saying that the test positivity continues to increase while testing has remained the same, that suggests that this is a real increase in case that's being seen across Ontario. And it does speak to the importance of trying to get more of our population vaccinated, and especially where there might be greater activity, certainly not in Peel at this time, but in other jurisdictions across the province, taking additional measures should they be necessary.
So we're looking at up to 3,000 new daily COVID-19 cases in the province in the worst case scenario. ICU occupancy could also spike in the new year. Does that concern you at all when we talk about hospitalizations going up?
Well, I think the bigger picture that the Science Table actually provides in respect to the case and hospitalizations is what we can do in the meantime in order to address the models. Again, models are not a forecast saying that this is definitely going to happen. Mm-hmm. They are meant to be forecasts that are for action to really ensure that we move forward in interventions that need to be done. So here in Peel, for example, we do know that any increase we're starting to see is driven by the fact that our 5 to 11 population now has become our most significant driver of cases in the region of Peel. And so getting that population vaccinated is a top priority for us, as I understand it is across the entire province of Ontario.
And so based on the modeling that we received today, is there anything that we should be focusing on more or doing more over the holidays, Dr. Lowe?
Well, I think the biggest thing is just to remember that there are still limits in place with us at exit step 3 of the exit step in the province of Ontario. There are still limits on indoor gatherings across the province to 25 people, and there is still federal guidance that suggests if you're getting together with individuals, particularly those that may be unvaccinated, you want to make sure that you're wearing a mask if distancing isn't consistently observed. It's also important that if you are sick, you don't attend gatherings, even if you're mildly ill, even if it's just a cold or whatever you think it might be. Best is to get tested and to make sure that you're self-isolating. And then finally, I think the most important thing is to continue to be vigilant when you're out and about in crowds, wearing a mask indoors, making sure that you're sticking with vaccine certification requirements, which I'm pleased that the province has actually decided to pause, as I understand it from reports. In terms of lifting, it is vital that we continue to remain vigilant and to get 2 doses of vaccine for anyone aged 5 and up to make sure that we're able to bring the best scenarios that the model proposed to reality.
Yeah, I wonder if you can give us some more guidance on that population, because the majority of people above that age group have already gotten vaccinated at this point. What do you want to see happen to be able to not reach those really high numbers that were in the data today?
So basically, it's a vaccination and vigilance. So if you're over the age of 5 and you haven't accessed vaccination at this point in time, it's important to access vaccination. Especially we know for kids, Delta is different. Delta is it does have different impacts and risks for children in respect to severe outcomes as well as long COVID. So getting anyone over the age of 5 vaccinated with 2 doses without delay is important with our Delta surge that is being foretold by the provincial science table. And then for anyone who is already vaccinated, vigilance with masking, vigilance with, making sure that you're staying home and getting tested if you're sick, as opposed to being out and about, keeping groups small and reasonable within the provincial gathering limit. Those are all things that are hopefully going to keep the holidays fun and celebratory, but also a little bit safer.
Okay. Dr. Lawrence Lowe, thanks so much for your time tonight. We appreciate it.
Thanks so much for having me.
Thank you.
Toronto's Board of Health has voted unanimously in favor of the Toronto model for preventing overdoses. The approach includes requesting an exemption from federal laws in order to decriminalize small amounts of drugs for personal use. The plan, endorsed by Toronto's Medical Officer of Health, would also increase treatment and prevention programs, make harm reduction services more accessible, and provide referrals for drug users. A recent report from Toronto's Medical Officer of Health, Dr. Eileen Davila, said there were 531 opioid toxicity deaths in the city last year, an 81% increase from 2019. For more on this, we're joined by Toronto City Councillor Gord Perks. We're joined by a professor of sociology at U of T, Akwasi Owusu Bempa, and Kari Kozirok, executive director of Veahovta, a community support group that provides programming and services to the homeless community, and that includes harm reduction services. Thank you all for joining us so much tonight. Councillor Perks, I want to start with you. For those who are maybe critics of this approach, how is it that this initiative will essentially save lives?
Well, the biggest problem we have in the way we treat drugs and people who use drugs in the city of Toronto and Canada is criminalize them. And as a result, people wind up incarcerated or with records or being hassled by police. They lose their homes, they lose their jobs, and it creates real social division. And if we can get that piece out of the way, if we can decriminalize the simple possession for personal use, those problems go away and we have a much healthier society and we save lives.
So Professor Owusu Bempa, if perhaps you can elaborate, I mean, are there that many people that are incarcerated, or I should start off by saying, are there that many people who face charges for having a small amount of illegal drugs on them compared to the sadly massive number of overdoses we've seen in the city?
Yeah, so in the city of Toronto last year, there were about 1,600 people who were charged with simple drug possession. Now, that doesn't include all of the individuals who the police came across and decided not to charge. But I think beyond that, what would be a relatively small number in the context of a city like Toronto, we need to consider just what a detrimental impact that has on those individuals for the rest of their lives, as well as those around them. So I don't think we can understate the impact that criminalizing people for drug use, which is something that people will do whether or not drugs are illegal, has on the individuals and on society, and ultimately what it costs taxpayers to deal with.
And Professor, you make a point here. I mean, someone who faces a charge and then a conviction for having a small amount of illegal drugs on them, whether they suffer from addiction or not, long-term that could impact employment and other areas of life. There is a real long-term impact here.
There's a huge long-term impact here. People who are criminalized for, minor drug possession are typically people who don't have the benefit of being able to hire a decent lawyer who can get them out of that charge. Because for most people, they're going to be able to, for many people, they're going to be able to fight that if they have the means to do so. But yeah, it impacts upon their ability to, integrate into and succeed in our society generally, as you've noted, find employment, finish their education, increasingly secure housing, volunteer, to travel. And so we push these people further to the margins of our society, which only increases the likelihood that they're going to continue to use drugs and to engage in other antisocial activities, perhaps to support their drug habits. So, from my perspective as a sociologist, someone who studies drug policy closely, drugs are not the problem. It is our approach to dealing with drugs which is the problem. And this is why I'm, quite thankful to see the steps that are being taken in the City of Toronto now.
And Carrie, I'll get to you in just a moment to talk about the impact. Another question here for Councillor Perks. I mean, you must feel quite confident as a Board of Health, as city councillors, that the federal government may move forward with this. There was a unanimous consent. Any indication that there will be some positive progress with this at this point? I mean, there's obviously a process to take place that will take place here.
So there have been preliminary conversations between City of Toronto officials and health officials, the Prime Minister's office. We've let them know we're doing this. We're watching closely what's happening in Vancouver and British Columbia further along. I imagine it will take a little while, but I'm quite confident we'll get there. And frankly, I'm very anxious to do it as quickly as possible. There are people dying, but also there are lives just being ruined. And, I hope the federal government takes this seriously and moves as quickly as possible.
Carrie, I want to bring you in. You were with the organization Vehahovta. This is a community support group, which, as I explained to you on the phone, I've been familiar with for years. People around the city may see your group's van traveling around, your mobile service at night, providing support to people primarily in the homeless community in the city. And you have seen, and your group sadly, even in the last day, the firsthand impact of addiction. And as our panel is saying here, I think we are in society beyond that idea that someone who uses drugs is a criminal. These are real people who are suffering from an illness. What can you share with us?
I think it's really just that. I mean, when we look at addiction and substance use through a lens of health and mental health, it changes the picture. It wasn't that long ago that in Canada, suicide was criminalized, and it was decriminalized only as recently as 1972. And it's a comparative for the lens through which we look at addiction and substance use. And, I can speak to the work that we do between serving people who are currently experiencing homelessness through our outreach van, and also the programs that we run to prepare people to re-enter the workforce. The stigma that is attached to substance use, the stigma that is further attached to criminal records, makes people turning their lives around very, very difficult. It's already very difficult, but those types of things like a criminal record really add to it, adding an additional barrier and burden to people who are facing a lot already.
And Carrie, we know that there has been this toxic supply of opioids here in the city that is causing a fair number of tragedies here in the city. How would, in your opinion, something like what the Toronto Board of Health has moved forward with, help, if at all? I mean, the idea behind this potential legislation is that if someone needs support, they're struggling with an illness, they're not going to be penalized for having a small amount of drugs on them if they're suffering from an addiction. But what does that do when we take a look at these bad drugs that are circulating? Does it do anything?
It's hard to say what it would do around the bad drugs, but what we do know is our van distributes harm reduction supplies. We have people who approach us, and we have to be very discreet. We have folks who are shy to ask off of from our outreach workers for these supplies because there is so much stigma attached. I think that if we start to look at this as a shared responsibility as a health problem, if people who are using substances felt that they had resources to go to check the drugs that they're about to use for supervision while they're using, and it was brought out from, the dark recesses of the city and into the open light, I think that we could prevent some deaths and some overdoses. And I think that anything we can do to prevent those is worth trying.
Councillor Perks, thank you, Carrie. What is small possession? What would be the definition of that?
Well, there's the rub. There's a disagreement that came to light in British Columbia as they were doing this about the amounts. We're still having that conversation here in the city of Toronto, and that's why we want to develop our own Toronto model. Basically, what you want to do is stop having the police interact with people who are just simply using drugs or maybe holding drugs for a friend. Yes, we need to think about, the large labs that are out there making these dangerous illegal drugs. And yes, we have to think about policing that. But just policing someone who uses drugs has no social benefit and enormous social.
Even just, in my lifetime as a reporter, I mean, marijuana had been illegal in terms of using it recreationally. And as you noted, one of our panelists, I believe it was our professor here, or Carrie, suicide had once been something that's illegal. Certainly, our views are changing on what is best for people in society from a mental health and a public health perspective. That is all the time we have. I want to thank you all. I want to, Professor Owusu Bempah, Carrie, and Councillor Perks, thank you for your time. Obviously, we know this is something the federal government is considering, not only here, but also in BC, and we'll keep a close eye on this. Thank you so much.
Thank you.
Ontario's advisory panel of top epidemiologists recommends the use of rapid antigen tests for all elementary school students, especially in parts of Ontario where COVID-19 is most infectious. Today, the COVID-19 Science Advisory Table said that in areas where there are 35 or more weekly cases per 100,000 people, elementary students should be tested with a rapid antigen test once per week. That threshold includes virtually the entire province except for some of the GTA.
And the science table says it considers rapid testing in elementary schools a priority since students under 12 are not fully vaccinated yet in the province. And rapid tests are consistently able, is what I'm trying to say, to detect a positive result in people with a high viral load. That's the point in time which that someone is most likely to infect others. And of course, the test is able to do it, well, rapidly, immediately. So joining us now to talk about all this, Dr. Peter Jüni, Director of Ontario's COVID-19 Science Advisory Table. We also have joining us, we have Bronwyn, who is with the Bronwyn Aslop, a mother, and she's behind the group Ontario Families Coalition. We also hope to have Pamela join us soon, another parent. Bronwyn, if you could stand by for just a moment, we have some developing news that we want to speak to Dr. Jüni about, separate from the topic we invited you on here for today. So, Dr. Jüni, we're going to bring you up here for just a moment. I want to share with you something we've learned tonight. Multiple sources have told CTV News that the Toronto government, that the Ontario government, that is, was presented earlier this week at a meeting with several options, including closing schools for a period of time before and after the winter break, or moving the province to step 3 of its reopening plan. This is because of high case counts and, of course, the number of cases amongst children. However, we were also told the government was not prepared to move forward with that. I want to ask you, is this something the Science Advisory Table recommended to the Ontario government? And if not, would you have supported that?
I'm not sure which part now you're talking about. So we haven't advised specifically on any of those issues, but it's clear, it's not right now, just the situation with Delta, there we could perhaps, just act locally a bit more. But what is really threatening is Omicron. It's clear this will take over the world, unfortunately, as the next variant. And we see that, protection against infection is much, much less also with vaccines. So in this situation, considering step 3 is absolutely a good idea. Let's remember what we talked when we talked about schools. We were very outspoken, from the side of the science table that schools should be the last resorts to control the pandemic. And, it won't change fundamentally the situation we're in with Omicron. We need to be aware of that. If we want to deal with that, we need to do something with capacity limits.
Okay, so to be clear, you wouldn't recommend the closing of schools for a period before and after the winter break, but perhaps returning to step 3 is something that, as a doctor, as an expert, you would perhaps recommend or suggest?
Yeah, we have a challenge here. Omicron is about to take over this province, as a lot of other places in the world. And if we want to get this under control, we need to, because otherwise, again, we will have trouble with our healthcare system being overwhelmed. We will need to react relatively early. And capacity limits is absolutely one of the things that will need to be looked into relatively urgently. The other part is we need to really speed up and message well the rollout of the 3rd doses of our vaccine.
Okay. I want to talk to you about Massey, who is the Raptors president and vice chairman. We've actually just learned that he has tested positive for COVID-19. He was at an event. We're showing some video of it now. This is the Giants of Africa event on Sunday. Many people were there. Everyone who attended had to show proof of vaccination, wear masks when not eating or drinking. There was public health measures in place. Unfortunately, he says, after the gala, he learned of a number of positive COVID-19 tests amongst guests, and even though he was fully vaccinated and received a booster, he too tested positive. Now, Dr. Uni, we saw today the largest number of cases in the province are amongst vaccinated people. I want to get your reaction to this, and is this, taking a look at this, is the idea, even though these events are allowed, we can't move forward with them?
And we have a problem with Omicron coming. We don't know what's happening there, but we know, for instance, now for the situation in Oslo, there was a Christmas party that Omicron resulted in a really high attack rate of people who then got infected. This could be an issue here too. So first of all, once more, just let's remember, right now, 87% of 12 plus are fully vaccinated. So it's hardly surprising if there are a little bit more vaccinated people who actually just constitute cases. The point is, with Omicron, we have an additional challenge and we need to be very careful indeed. And so here the situation will be, now put yourself into the shoes of a public health unit and contact tracers, what to do in this situation. You need to evaluate how high the risk was. And we don't know enough yet about Omicron. It's just really very transmissible.
Okay. Well, let's switch gears now and talk about this rapid antigen testing. And before we bring in Pamela and Bronwyn, Peter Uni, Dr. Uni, I want to ask you one more question about this in terms of what's changed. Because when I look at last summer with the Science Advisory Table, the recommendation at that time was this surveillance is not necessary. The table said that it wasn't going to detect enough of students and so that it's not worth doing. So now looking back in hindsight, should it have been done earlier?
No, I think we're in a completely different situation. The pressure is much higher because we don't have the same public health measures in place. We have the Delta variant right now. Forthcoming is Omicron, much more transmissible. And we have now a specific segment of the population, 5 to 11-year-olds, who actually attend school, etc., who can't be fully vaccinated yet. Therefore, we bring this up. In addition, we have a lot of additional evidence, and we really went very far, just to address all the potential criticisms that we heard regarding these tests and just figure out, do they actually work? Do they perform well enough? And they do.
Okay.
Well, let's ask Bronwyn now, because Bronwyn, you heard Dr. Uni and his response. You've been a large advocate for tests to stay, and that's been a recommendation now put forward. What's your take on what's been done and if it's too little too late?
I think it's too little too late. It's imperative that we do it, but I had to advocate and fight very hard for my son's school last week that was shut down unnecessarily to have these tests accessible. His school was shut down for only 6 cases. He's deaf and hard of hearing. And we had to go through again this nightmare of virtual learning unnecessarily when we could have been having the accessibility of the test to stay at our fingertips beforehand. And we've known that we could have had access to this for quite some time. The minister had approved it, I believe, in late October. So for me, this is too late. I'm glad it's happening now, but I am sick with COVID, with this tendency where we have access to things much more earlier, and then we seem to get it at a time in crisis where we're heading into a more dangerous direction with the new variant, and we are going to continue to keep seeing more variants come. So I hope before the next one comes, which will be happening, that we are more prepared again, because I keep hearing the same thing, that things are getting worse, things will elevate, but then we get access far too late. So I'm frustrated with that.
So Bronwyn Aslop, you're a mom and you're behind the group the Ontario Families Coalition. Thank you so much, because I want to introduce our other guest here who's now been able to join us, Pamela Libralesso, who is behind the group Ontario Families of Group Home Residents. You're also a mother of 2. Pamela, you and I have chatted a lot throughout the pandemic, as I have with Bronwyn. So nice to have you join us, Pamela. And for you as a mother with a child who has specific needs. You had a situation recently where you had to run around everywhere to get a rapid test. And this is not easy for parents like you and really any parent.
Yes, last month there was a positive test in my son's classroom. He attends, he's in grade 10, and he's in a life skills classroom with 9 other students. There was a positive case in his class. As far as I'm aware, most of the students and staff are vaccinated. However, we wanted to do the right thing. And although my son is fully vaccinated and wasn't showing any symptoms and was entitled to return to school the very next day, we wanted to do the right thing to keep everybody safe and get him a test. And the only option for us was to go to a testing center. And with a child with disabilities, it's very difficult to do that. In our case, we're lucky that our local testing center has very accessible PCR testing. They could do it in the car, but for some kids and adults, that doesn't work. So it would have been great for us to have had access to a rapid test at that time.
And you know, Dr. Uni, you're hearing from mothers like Pamela and Bronwyn, and the recommendation from your science advisory table, not only testing of elementary school students, but test to stay. We are going to hear from Dr. Moore tomorrow. There's also a cabinet meeting. Do you anticipate we will hear an announcement that after the holidays, because there's some 11 million kits going home with students for the holiday break, that the Ontario government has frankly felt the pressure and will move forward with what you're recommending? Do you think that'll happen?
I don't know. You know, I don't have a crystal ball. We have regular exchanges, and Dr. Moore is aware of the science brief, obviously. I think, you know, that this is moving into the right direction. It is challenging. I completely acknowledge that, and it's also frustrating. The point is, in addition to, you know, the rapid tests, we also have a lot of rollout just of self-testing for PCR tests in many schools, for instance, in the Toronto area. I'm not sure where you are based, and it will be a combination of different efforts here. We need to be aware also, you know, that things probably will change with Omicron coming, and we need to do more testing once Omicron is here, which is actually now.
Dr. Uni, let's get into how this is going to work and how it could potentially skew the numbers of COVID cases, because let's say you're taking the cases home and someone tests positive. Are there any checks and balances to say, okay, you need to report these cases? Because if they're not reported, then A, you don't have the true number of cases, and then B, you can't do proper contact tracing. So is there anything in place to make sure that these tests are not only going to be handed out, but that they're going to be handed out effectively?
This is absolutely a concern. You know, there are various issues. First of all, this is a screening test, meaning a screening test needs to be reconfirmed, because it could also be a false positive anyway. And the reconfirmation happens through PCR, and this should also ensure, but there are logistical issues there, that the contact tracing and testing and management actually just comes into play, indeed. And we see that in other jurisdictions. Once you see rapid tests just rolled out more frequently, it's more challenging to understand what the case numbers do for a moment before you are in a new steady state. It's a real concern that I agree with you. All needs to be figured out. We talked about the science. We can't address, or we didn't address, all the logistical challenges. This would be a phone book.
So, Dr. Union, again, we appreciate your time. You make yourself very available to us, and we appreciate it. And you've heard again from these moms, including Bronwyn, whose group advocates for keeping kids in the classroom as opposed to online learning. Now, in terms of your scientific expertise, do you anticipate, if the Ontario government does not move forward with the science table's recommendations, that there will be a pivot to online learning at some point?
I honestly hope this won't happen. We were very outspoken about that. You know, I have a conflict of interest. We have 4 kids, 2 grown up and 2 really small ones. Not with learning disabilities, but it's a real challenge. I know how difficult this is. We shouldn't punish our children in the future, you know, with more challenges. We can't use schools as a lever to control the pandemic.
And Bronwyn, I want to give you the last word here. You heard Dr. Uni say right there that they want to do everything to keep schools open. I know you've talked about the challenges for your children in terms of going between online learning and in-person learning. You want to keep the schools open. You must be hoping for that.
It better be open. I'm also an early childhood educator in a private daycare, and I have been working through this through the thick and thin, and schools have been considered throughout the pandemic to be the danger zone, which are always, I always hear the line of they are the last to close, but for some reason they're always the first to close and everything else gets open still. This cannot happen again. Our children need in-person learning. And if we are 2 years into this pandemic and we still make the dangerous decision for our children's mental health to close schools, then I will be beside myself, because it means that we have not learned anything over the last 2 years to know that the suicide rates with children have gone up, obesity, the damage to mental health for children and parents has been detrimental, and it is time that we understand that we cannot go through school closures again. So that's how I feel. So if it happens again, watch out.
Okay, I think that's all the time we have for today. Pamela, thank you as well for joining us on the show tonight. I know I will continue the conversation with you and Bronwyn as well. Thank you for the work you do as moms and advocates. And Dr. Uni, again, for making yourself always available to us. We're going to have a lot to talk about in the next few days, so thank you for your time.
Thank you.
Thank you.